Hi, my name is Campbell. This is Nursing 612 Advanced Health Assessment. Today I will be presenting my Advanced Assessment Checkoff video. This is Amber. She is a 36-year-old female who's volunteered to be our assessment subject for today. Amber was asked to empty her bladder. She's been placed in a gown. I washed my hands. We began our assessment with a full set of vital signs, which were all within normal limits. Amber completed a visual acuity test by the Snellen chart, where she demonstrated 20/20 visual acuity, which is also assessment of cranial nerve 2. I'm going to continue the assessment now with inspection of the head and face. I'm going to look for symmetry of the eyes and ears. I'm going to look for an overall roundness of the head and skull, no variations. I'm going to also inspect Amber's ability to clench her teeth, wrinkle her forehead, puff out her cheeks, smile, stick out her tongue, move from side to side. I'm now going to palpate the skull, doing a circular motion from front to back. I'm going to note any lesions, masses, or tenderness that I may find. I'm also going to palpate the facial bones. I'm going to palpate the temporomandibular joint by placing my fingers just below the tragus. I'm going to ask Amber to open and close her jaw. I'm going to assess for any popping, unusual clicking, pain, or locking of the joint. I'm also going to palpate the sinuses, the frontal sinuses, noting any tenderness or pain with palpation, the maxillary sinuses, the ethmoid and sphenoid sinuses. Do you feel any pain with those? I'm now going to move to my examination of the eyes. I'm going to begin with an external examination. I'm going to look at symmetry of the eyes. I'm going to also look at the overall hair distribution of the brow and the lashes. I'm going to have Amber open and close her eyes, noting any drooping of the eyelid. I'm going to inspect the conjunctiva and the sclera by asking Amber, by pulling Amber's eyelid down. I expect that the conjunctiva is pink and moist, the sclera to be white. Both eyes. I'm also going to have Amber look up and to the left and down. I'm going to palpate the lacrimal apparatus, having any tenderness. I'm now going to assess Amber's pupillary response by using a light. I'm just going to have you look forward. You can look at me. I'm going to shine a light in your eye and remove it just look forward. I'm going to first assess for direct pupillary response in the actual eye that the light is shining. And I'm also going to look for consensual in the opposite. I'm now going to assess Amber's extraocular eye movements by assessing her visual field of gaze. I'm going to use an H technique for this. I want you to look at my pen light. I'm going to move it in different places, and you're just going to follow it with your eyes, not with your head. We're also looking for convergence. I'm going to assess the cover uncover test. I'm going to have you cover your left eye or the right eye. Okay, I'm going to move my hand. You tell me when you can see this. Okay. 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 That completes our assessment of the eyes, which was the assessment of cranial nerves 2, 3, 4, and 6. Previously, When we assess the head and face, we also assess cranial nerves 5, 7, and 12. We're going to move now to assessment of the ears. I'm going to begin with an overall general inspection, looking for symmetry, alignment, and positioning of the ears on the head. I'm going to palpate the auricle, noting any masses, tumors, scaliness, any abnormalities in the ear. I'm also going to perform a whisper test at this time. Due to our positioning, it's going to be a little bit off, but I'm going to stand behind you. I'm going to whisper a word. You let me know what word you heard me whisper. Okay. All right, we're also going to conduct a Weber and Rhine test at this time. Amber, I'm going to strike the tuning fork and we're going to place it on the top of your head. You let me know if you hear the sound, the vibration, or the noise equally in both ears or differently. Equally. Okay. We're going to conduct the Rhine test. I'm going to strike the tuning fork again. I'm going to place the end of the tuning fork on your mastoid process. You let me know when you can no longer hear the vibration. Then I'm going to also hold it to the side of your ear. You let me know when you can no longer hear. Okay, we would also inspect the ear with the otoscope at this time. I do not have an otoscope here with me today, but I would look into the ear canal, look in the external ear canal to see if there's any drainage, any excess cerumen. I would also look into the internal ear canal, looking at the tympanic membrane. I would expect to see that it is pearly gray translucent with visible landmarks readily notable. We're going to move to our assessment of we're going to move to our assessment of the nose. I'm going to inspect the mucosa, the septum, the structure, the turbinates. We're going to just look for overall normal position of those, no deviation of the septum. I'm going to look up the nose for the things that I mentioned. Expect to see that it's nice and moist and pink, no redness or irritation, no swelling of the turbinate, no deviation of the septum. I'm also going to verify patency of the nares. I'm going to have you occlude one side of your nose and breathe in, and then do the opposite side. And that completes our assessment of the nose. We're going to move to the mouth and pharynx. I'm going to assess the mouth for the lips for dryness. I want to see if they're moist. I don't expect to see any lesions or cracks in the lips. I'm also going to inspect the buccal mucosa, the gums, the hard and soft palates. I'm also going to inspect the oropharynx, the anterior posterior pillars, the uvula. I want to see if the uvula is midline, pink, gag reflex or with the awe reflex. I'm also going to inspect the teeth. I'm going to look for the characteristics, note the number, the condition of the teeth, note the presence of any dental caries or lack thereof. I'm also going to look at the tongue for the color, for the absence of sores. I'm going to look under the tongue, around the mouth. We're going to do that at this time. Look. Raise your tongue. Put your tongue out. Alright. And close your mouth. I'm going to put finger pressure in the back of your mouth so it's a gag reflex. Okay. And then say off for me. Off. That's assessment of cranial nerve 9. We're going to move to the neck. We're going to begin with inspection. We're going to look for symmetry and smoothness of the neck and thyroid. We're going to look to see if there's no abnormalities that actually stick out to my vision just upon inspection. I'm going to look for jugular venous distension. And I don't see any of those things here just by inspecting. I'm going to inspect Amber's ability to perform range of motion. I'm going to have you tilt your head from side to side, look down at your chest, and then back. Okay, and then lay your head backwards. I'm also going to perform that to resistance now. Lay your head here. Forward and back. Shrug your shoulders for me. I'm going to palpate the carotid arteries. We're going to do that one at a time. Also going to palpate the trachea. Expect it to be midline with no deviations. I'm also going to palpate the thyroid. And could you swallow for me? I just want to note the borders of the thyroid, if it's palpable, that they're regular and within normal size limits. We're also going to palpate the lymph nodes at this time. We're going to start ahead with the preauricular, the postauricular, the occipital, the temporal, the submental, the submandibular, the superficial cervical chain, the posterior cervical chain, the deep cervical chain, and the supraclavicular lymph nodes. I'm going to auscultate the carotid artery and the thyroid. Noting any bruise that may be present. Now I'm going to look at Amber's upper extremities, her hands, her arms, her shoulders. I'm going to look at the skin, the characteristics of presence of dryness, scaling lesions, any breaks in the skin. I'm also going to look at her nail beds, her cap refill. We want that to be less than 3 seconds. And brisk. I'm going to note any edema if it were to be present. I'm also going to notice the color and temperature of Amber's extremities. I'm also going to assess the radial and brachial pulses. I want those to be equal and strong bilaterally. We are now going to move to inspection of the back and posterior chest. If I could just have you turn, you want to, yeah, that's fine. I'm going to look at the overall appearance of the skin, the thoracic configuration, the interior posterior diameter should be 1 to 2. While I'm inspecting the back and posterior chest, I'm also going to palpate and percuss the costovertebral angle. I'm going to do that now. And let me know if you feel anything. This should not feel tenderness with palpation of the costovertebral angle. I am now going to begin inspection of the posterior lung. I'm going to look at respirations. I expect those to be 18 to 22, even in unlabored, with no wheezes, bronchi, or adventitious breath sounds. I'm going to palpate for expansion. I put the baby in my hands, fingers back. Sorry, my hands are cold. Take a deep breath for me 3 times. Again. I'm just noting symmetrical chest expansion. I'm going to assess tactile fremitus. Amber, I'm going to use the polar aspects of my hand to begin with. When I place my hand on your back, I want you to say 99, and each time I move my hand, I want you to say 99. 99, 99, 99, 99. Okay, and again, we're going to do it with the polar aspect of my hand. 99, 99, 99. Okay, good. I am now going to percuss the posterior chest and the lateral chest. I would expect to hear resonance. I'm going to do this with symmetrical. Noting any variations that I may hear or changes in sound, I hear none of. Can you put your hands over your head, please? I'm also going to assess for diaphragmatic excursion, which I expect to be approximately 3 to 5 centimeters. I'm going to have Amber leaning forward with her hands crossed in front of her chest, leaning forward. I'm going to ask Amber to take a deep breath and hold it. I'm going to percuss until I hear a change in sound. Go ahead and take a deep breath for me. Okay, once that is noted, I'm going to have you let your breath out. I would mark this with a pen. You can notice where that mark is at. I'm going to have you take a deep breath in and out 3 times, letting as much air as you can out. Then I'm going to percuss upward until I meet a different sound. Would then mark that area again. And we have 3 to 5 centimeters resistance for diaphragmatic excursion. I'm going to auscultate the posterior and lateral chest. Just take some breaths for me. And lateral. Raise your arms slightly. Okay, we're going to move to the anterior aspect of the chest. Once again, we're going to look at the skin. We want to see that it is pink, and moist, and dry. We want to see if there's no cyanosis present. We're going to again assess the respiratory rate and effort. We expect it to be between 18 and 22. Even in unlabored with no accessory muscle use, no signs or symptoms of air hunger. We're going to also look for any pulsations, thrills that may be present. We're going to inspect the chest wall by palpation. I'm just going to palpate. You feel any tenderness, any soreness, any pain. I'm also going to palpate the precordium, beginning with the apex. The left sternal border and the base. I'm also going to locate the apical pulse at this time with my hand palpation. I'm once again going to assess for tactile fremitus, and I'm going to use the palmar aspect of my hand. 99, 99, 99. Okay, I'm going to auscultate the anterior chest. We're going to also take for heart sounds aortic, pulmonic, sphenoid, tricuspid, mitral. I'm also going to palpate for the infraclavicular nodes and axillary nodes. We are going to move to the assessment of our abdomen. And if I could have you lay down with your head here. I'm going to begin with inspection. I'm going to inspect the overall contour and symmetry of the abdomen, noting any abnormalities, any raised areas, any masses or raised areas in the abdomen that are noted by vision. I'm going to first auscultate the abdomen in all four quadrants. I will listen for 2 to 5 minutes. If I hear nothing at 2 minutes, I will auscultate up to 5 minutes. Beginning with the left lower quad. I will also auscultate the abdominal arteries, the aorta, iliac, renal, and femoral. I will now percuss over the abdomen. I'm going to expect to hear tympany over air-filled areas, dullness over organs. So I'm going to begin with just a general percussion. I'm now going to percuss the liver border. I'm going to start mid-clavicular line. So I'll hear over an area of tympany until I hear a sound of dullness. I'm going to mark that area. I'm going to begin percussion downward to upward until I meet an area of change. I'll mark that area. I expect that to be 6 to 12 centimeters. I'm going to percuss the splenic border. I'm also going to percuss or palpate, begin with light palpation of the right costal margin and the left costal margin. The right costal margin to identify the border of the liver, and the left for the spleen. I'm going to use deep palpation to identify the liver. And if you take a deep breath in. I'm also going to do the same for the spleen. On the left side and posterior. I do not expect to palpate the spleen. I'm also going to palpate the left kidney, the right kidney. Amber, could you raise slightly up? I'm just going to test your abdominal muscles. Okay, go ahead and set up. I'm going to move to inspection of the feet and legs. I'm going to look for overall hair distribution. If you want to put your legs back up, that's fine. I'm just going to look at the overall hair distribution, the skin, dryness, any lesions, any breaks in the skin, any edema. I'm going to assess the pulses in the lower extremities, beginning with the popliteal. The dorsalis pedis. And posterior tibial. I'm going to note the amplitude, rate, and rhythm of the pulses. I'm also going to pay attention to the muscle mass and inwards extremities, make sure that those are nice and strong. I'm going to move to the musculoskeletal portion of the exam. I'm going to check reflexes of the brachial. I'm going to check her brachial, her popliteal, her Achilles tendon. Repeat this set with your feet over. Start here. If I could have you stand up, I'm just going to look at your spine. I'm going to look at the overall symmetry of your shoulders, again, your posture, the way that you're standing. I don't see that you're leaning from one side to the other. I'm just going to palpate down the spine. Do you feel any tenderness or pain in your back? Okay. I'm also going to have you lean forward. I'm going to once again inspect and palpate. I'm looking for any signs of scoliosis or degenerative type diseases in the back muscle or in the spine. Okay, sit down one more time for me. We have two more things to do here and we'll be done. I want you to push against my hands with your legs and don't let me push you back. Okay, I'm going to push out on your knees and you push my hands in. Okay, and then out. That demonstrates that your hips have good strength and are in good positioning. I do know that I left out one of my inspection during the inspection of the head and face. I need to go back and get Amber's ability to identify light sensation. If you can close your eyes, I'm going to touch your face in a few different places, and you tell me when you feel me touch. You can say now or say yes. Okay. And with the assessment of the head and face, I've assessed cranial nerves 5, 7, and 12. I believe that's the completion of our assessment. Thank you.